This is the complete cayenne pepper guide, where we'll show you 15 amazing science-backed benefits and the exact dosage to use it the right way. Capsaicin, the compound that creates the burning sensation in your mouth, has shown promising cardiovascular benefits in research studies. What if the same compound that burns your mouth can stop a heart attack in 60 seconds? Sounds crazy, but the research is shocking. Right now, millions spend $400 monthly on heart medications with dangerous side effects. Meanwhile, cayenne pepper sits in spice racks for under $1, delivering results that research suggests are comparable to prescription drugs. Studies show 33 to 57% pain reduction after 4 weeks. Research involving approximately 487,000 participants reveals 14% reduced all-cause mortality in those consuming spicy foods regularly. 487,000 participants reveals 14% reduced all-cause mortality. That's associated with preventing 1 in 7 deaths, naturally. But here's the thing. Take cayenne pepper wrong, and you could end up in the emergency room. Benefit number 7 could literally save your life. And the combination protocol at minute 15? That's where benefits multiply exponentially. In today's video, you'll discover all 15 science-backed benefits, exact dosages that actually work, and the critical mistakes that destroy effectiveness. Stay to the end. What we reveal about black seed oil might be the most important health information you hear this year. What is cayenne pepper and how it works? Your cardiovascular system is under constant assault. Plaque accumulates daily. Inflammation attacks relentlessly. Pain signals overwhelm your nervous system. Modern medicine treats symptoms, rarely touching root causes. Cayenne pepper contains capsaicin, a bioactive compound working on multiple pathways simultaneously. When capsaicin binds to TVRP1 receptors, it triggers healing cascades throughout your entire body. Blood vessels produce nitric oxide, dilating and improving flow. Pain signals get blocked through substance P depletion. Inflammation markers decrease significantly in laboratory studies. We're talking reductions of 30 to 40% in key inflammatory cytokines. Here's what nobody tells you about dosage. Standard cayenne pepper ranges from 30,000 to 50,000 SHU, Scoville heat units. This represents typical capsaicin concentration in commercial products, about 0.3 to 0.5% capsaicin by weight. Therapeutic benefits come from consistent capsaicin intake at these levels. Quality cayenne within 30,000 to 50,000 SHU provides therapeutic capsaicin levels necessary for the health benefits we're about to discuss. Lower grade products contain less capsaicin, reducing effectiveness proportionally. Some cheap brands contain as little as 5,000 to 10,000 SHU, which means you'd need 5 to 10 times more to get the same therapeutic effect. Now, let's dive into the benefits. But pay close attention to benefit number 1, because what we're about to reveal about cardiovascular health represents emerging research and contradicts everything mainstream medicine teaches about natural remedies. Number 1. Cardiovascular health and circulation enhancement. Arterial plaque is building up right now in 70% of adults over 40. You won't feel it. You won't see symptoms for years, maybe decades. Then suddenly, heart attack or stroke. It's the number 1 killer globally, claiming more lives than all cancers combined. Research published in multiple journals reveals compelling cardiovascular findings. Capsaicin activates TVRP1 receptors in blood vessels, triggering beneficial responses. Animal studies demonstrate atherosclerotic lesion reduction. Population studies examining spicy food consumption show associations with human population studies show decreased cardiovascular mortality. Here's the mechanism. LDL cholesterol undergoes oxidation when exposed to free radicals, then adheres to arterial walls like cement. These plaques form dangerous blockages that can rupture without warning, causing instant heart attacks. Research suggests that cayenne pepper supports cardiovascular health through multiple pathways. Laboratory and animal studies show it helps prevent LDL oxidation while supporting HDL cholesterol production, the good kind that removes plaque like a biological vacuum cleaner. Just half a teaspoon daily has been associated with cardiovascular support benefits in research provides these cardiovascular support benefits. Studies demonstrate measurable improvements in cardiovascular markers. Supporting arterial health is just the beginning. The silent killer affecting 1 in 3 adults? That's next. Number 2. Blood pressure regulation. Blood vessels constrict like compressed garden hoses, sending pressure skyrocketing to dangerous levels. Most people discover their hypertension only after a cardiovascular event. By then, permanent damage is done. Research shows varied results regarding capsaicin's blood pressure effects. Animal studies demonstrate capsaicin prevents salt-induced hypertension through TRPV1 activation and nitric oxide production. Human studies show mixed outcomes, with fermented red pepper paste showing more consistent benefits. Here's what's really happening. Aging reduces nitric oxide production by 50% after age 40. Blood vessels lose elasticity and remain chronically constricted, forcing your heart to pump harder with every beat. Animal research shows cayenne pepper interacts with blood pressure through nitric oxide pathways, increasing production via TRPV1 receptor activation. Vessels dilate when nitric oxide increases. Pressure may normalizes in responsive individuals. The proper dosage is half a teaspoon twice daily, morning and evening with meals. This protocol shows benefits in animal models. Your blood pressure is potentially normalizing. Your arteries are clearing. But there's another cardiovascular threat lurking in your bloodstream right now. Number 3. Natural circulation enhancement and clot prevention. Every 3 seconds, someone dies from thrombosis, a blood clot blocking critical vessels. Platelets prevent bleeding when injured, but excessive aggregation forms deadly clots that can travel to your brain, heart, or lungs without warning. Research reveals capsaicin's effects on platelet function and circulation. Laboratory studies show capsaicin influences platelet aggregation patterns, though it should never replace prescribed anticoagulants. It demonstrates natural circulation support properties. It's a natural circulation supporter without the severe bleeding, bruising, or hemorrhage risks of pharmaceutical drugs. The mechanism is fascinating. Fibrinogen creates mesh-like structures in blood, trapping red blood cells and forming dangerous clots. These can break loose anytime, causing instant death or permanent disability. Laboratory research suggests cayenne pepper supports circulation by influencing fibrinolytic pathways, your body's own clot management mechanism. Circulation enhancement improves as blood flows more freely. Take cayenne with breakfast and dinner for optimal results. Your circulation is flowing, your heart is protected. But what about the chronic pain destroying millions of lives daily? Number 4. Pain relief. Chronic pain destroys quality of life for over 100 million Americans. Every movement hurts. Sleep becomes impossible. Prescription painkillers damage organs, create dependency, and kill more people than all illegal drugs combined. Clinical trials reveal exactly how cayenne pepper works for arthritis at the molecular level. Capsaicin depletes substance P, the primary neurotransmitter carrying pain signals to your brain. No substance P means no pain transmission. Studies show 33 to 57% pain reduction within 4 weeks, with 80% of patients experiencing improvement after 2 weeks. Here's the challenge. Cayenne causes temporary burning sensations as it depletes pain neurotransmitters. Some people experience increased discomfort for 72 hours before relief begins. Push through that initial burning phase, it's actually proof the treatment is working. Your TRPV1 receptors become desensitized after repeated exposure. Arthritis pain relief becomes substantial and lasting. Cayenne works for neuropathy through similar mechanisms. Apply topical cayenne cream 3 to 4 times daily for natural pain relief. Clinical trials confirm effectiveness. Number 5. Weight loss and metabolism boost. Excess weight affects 70% of Americans, contributing to diabetes, heart disease, and cancer. Diets fail 95% of the time. Exercise alone rarely produces significant weight loss. Metabolism slows with age, making weight gain almost inevitable. Research demonstrates that capsaicin creates a modest thermogenic effect. Cayenne pepper boosts metabolism through thermogenesis. Some studies show modest increases in energy expenditure. Capsaicin increases energy expenditure by approximately 8% through sympathetic nervous system activation. Research indicates potential appetite-reducing effects. Studies show 74-calorie reduction in daily intake when capsaicin is consumed before meals. The mechanism involves brown fat activation, specialized tissue that burns calories for heat. White fat stores energy, brown fat burns it. Most adults have minimal brown fat activity. Research suggests capsaicin influences cayenne weight loss, works through multiple pathways. Capsaicin activates brown adipose tissue, increases fat oxidation, and appears to reduces appetite. The proper dose is 2 to 4 milligrams of capsaicin daily. Studies demonstrate modest body fat percentage reduction after 12 weeks. Okay, pause for a second. We're 5 benefits in, and your cardiovascular system is healing, pain is dropping, metabolism is firing. But here's where things get really interesting. The next 10 benefits target everything from blood sugar to brain health. Don't skip benefit number 7. It's the one that could save your life. Let's keep going. Number 6. Blood sugar control. Diabetes affects over 37 million Americans, with millions more pre-diabetic. Blood sugar spikes damage blood vessels, nerves, and organs. Current medications cause weight gain and other side effects. Research shows capsaicin influences glucose metabolism significantly. Animal studies demonstrate increased insulin levels and improved glucose tolerance. In animal models, diabetic rats showed blood glucose reduction from 19.3 to 14.7 millimoles per liter after 4 weeks of capsaicin treatment. The mechanism involves TVRP1 receptor activation in pancreatic cells. Insulin secretion increases, glucose uptake improves, and cellular metabolism normalizes. Animal and preliminary human research suggests cayenne pepper may support healthy blood sugar through enhanced insulin function. Glycogen storage increases, glucose absorption moderates, and metabolic health improves. Take half teaspoon twice daily with meals. Monitor blood glucose carefully if using diabetes medications. Number 7. Inflammation reduction. Here's the one that could save your life. Listen carefully. Chronic inflammation underlies heart disease, cancer, diabetes, and autoimmunity. It damages tissues silently for years before symptoms appear. Anti-inflammatory drugs cause serious side effects including stomach bleeding and kidney damage. Laboratory studies reveal capsaicin's potent anti-inflammatory properties. Capsaicin inhibits NF-kappa B signaling pathways, reducing inflammatory cytokine production. Studies show up to 40% reduction in inflammatory markers. The cascade begins at cellular level. Inflammatory signals trigger tissue damage, attracting immune cells that release more inflammatory compounds, creating a destructive cycle. Research demonstrates cayenne pepper breaks this inflammatory cycle naturally. Capsaicin modulates multiple inflammatory pathways simultaneously. Regular consumption is associated with provides systemic anti-inflammatory benefits. Half teaspoon twice daily has been shown to reduces inflammation markers measurably. Controlling inflammation is associated with reduced risk of prevents numerous diseases. Your inflammation is dropping, your blood sugar is stabilizing, but digestive health determines nutrient absorption and overall wellness. That's next. Number 8. Digestive health. Digestive disorders affect 70 million Americans. Symptoms include bloating, pain, constipation, and diarrhea. Medications provide temporary relief, but don't address root causes. Research demonstrates that capsaicin influences cayenne pepper, enhances digestive function comprehensively. Capsaicin stimulates digestive enzyme production, increases gastric blood flow, and research suggests it protects against ulcers, contrary to popular belief. The digestive process requires adequate enzyme production, proper pH balance, and healthy gut bacteria. Modern diets disrupt all 3 factors. Studies show cayenne optimizes digestion through multiple mechanisms. Salivary and gastric secretions increase, nutrient absorption improves, and beneficial bacteria flourish. Take quarter teaspoon before meals. Start with smaller doses if sensitive. Number 9. Respiratory relief. Respiratory infections cause millions of sick days annually. Congestion, coughing, and breathing difficulties reduce quality of life. Over-the-counter medications provide minimal relief with numerous side effects. Studies show capsaicin effectively relieves respiratory symptoms. Nasal spray containing capsaicin provides significant rapid relief from congestion and post-nasal drip. Improvement starts within 10 minutes of application. The mechanism involves TVRP1 receptor activation in respiratory tissues. Mucus production normalizes, inflammation decreases, and airways open. Cayenne clears respiratory passages naturally. Mix quarter teaspoon in warm water with lemon and honey. Gargle for throat relief, drink for systemic benefits. Use 3 times daily during respiratory infections. Number 10. Immune system boost. Immune dysfunction leads to frequent infections, slow healing, and increased cancer risk. Modern lifestyles suppress immunity through stress, poor diet, and inadequate sleep. Research reveals cayenne pepper's immunomodulatory effects. Capsaicin enhances immune cell function, increases antibody production, and provides antimicrobial activity against various pathogens. The immune system requires balanced responses, strong enough to fight infections, controlled enough to prevent autoimmunity. Cayenne optimizes immune function naturally. Regular consumption strengthens immune defenses without overstimulation. Combine with garlic and honey for enhanced effects. Take daily during cold season. We're at benefit 10 of 15. Your body is transforming, cardiovascular system healing, pain dropping, metabolism firing, inflammation clearing, immunity strengthening. The final 5 benefits get even more powerful. Stay with me. Benefit number 11 addresses the disease everyone fears most. Number 11. Cancer prevention. Cancer kills 600,000 Americans annually. Traditional treatments cause severe side effects. Prevention remains the best strategy. Laboratory studies demonstrate capsaicin's anti-cancer effects in cell cultures and animal models. Capsaicin induces apoptosis in various cancer cell lines, including prostate, breast, and pancreatic cancers. It inhibits cancer cell proliferation without affecting healthy cells. The mechanism involves multiple pathways. Capsaicin triggers cancer cell death, prevents blood vessel formation in tumors, and blocks metastasis in laboratory settings. Laboratory research suggests cayenne provides multi-targeted cancer research potential prevention. Regular consumption may support the body's natural anti-cancer defenses. Half teaspoon twice daily is used in ongoing research provides protective benefits. Combine with turmeric for synergistic effects. Number 12. Liver detoxification. The liver processes toxins, medications, and metabolic waste. Modern exposures overwhelm detoxification capacity. Fatty liver disease affects 100 million Americans. Research shows capsaicin protects and enhances liver function in animal studies. Animal studies demonstrate reduced liver fat accumulation and improved enzyme function. Capsaicin prevents alcohol-induced liver damage in research models. The liver performs over 500 functions including detoxification, protein synthesis, and hormone regulation. Dysfunction affects entire body systems. Animal research indicates cayenne supports liver health comprehensively. Capsaicin enhances detoxification pathways, reduces fat accumulation, and protects against damage. Take half teaspoon twice daily. Combine with milk thistle for enhanced protection. Number 13. Kidney protection. Kidney disease affects 37 million Americans. Diabetes and hypertension cause most cases. Dialysis costs exceed $100,000 annually per patient. Studies in animal models indicate capsaicin protects kidney function. Animal research shows reduced kidney damage in hypertensive models. Capsaicin preserves filtration capacity and prevents fibrosis in laboratory settings. The kidneys filter 200 liters of blood daily, removing waste while retaining essential nutrients. Damage accumulates silently over years. Animal research suggests cayenne may preserve kidney function naturally. Regular consumption in research supports filtration, reduces inflammation, and prevents damage. Half teaspoon twice daily is being studied for provides protective benefits. Monitor closely if kidney disease exists. Number 14. Cognitive enhancement. Dementia affects 6 million Americans, doubling every 5 years after 65. No cure exists. Prevention remains the only strategy. Research reveals capsaicin's neuroprotective properties in animal models. Animal studies show reductions in 41% reduction in beta amyloid plaques and improvements in 23% increase in cerebral blood flow. TRPV1 activation protects neurons from damage in laboratory research. The brain requires constant blood flow, glucose delivery, and waste removal. Aging compromises all 3 processes. Animal studies suggest cayenne may protect cognitive function comprehensively. Capsaicin improves brain circulation, reduces inflammation, and research shows it prevents plaque formation in animal models. Half teaspoon daily is associated with potential provides neuroprotection. Start early for maximum benefit. Number 15. longevity, and overall mortality reduction. Most deaths result from preventable diseases. Heart disease, cancer, diabetes, and stroke claim millions unnecessarily. Large epidemiological studies reveal striking associations with mortality benefits. Research involving approximately 487,000 participants examining spicy food consumption showed regular spicy food consumers experience 14% reduced all-cause mortality associated with frequent spicy food consumption. Additional research in Italian populations found Italian studies found even greater cardiovascular mortality reduction among chili pepper consumers. The mechanism involves capsaicin's multisystem benefits: cardiovascular protection, cancer prevention, metabolic optimization, and inflammation reduction. There you have it, all 15 science-backed benefits. Your body is transforming from the inside out. But here's the thing, taking Cayenne alone is good. Combining it strategically, that's where benefits multiply exponentially. Let me show you exactly how. Combination protocols. These powerful protocols multiply cayenne pepper benefits through synergistic effects. Each ingredient serves a specific purpose, working together to enhance absorption, amplify effects, and create results impossible with cayenne alone. Cardiovascular Cleanse Protocol. Mix ½ teaspoon cayenne, 1 teaspoon organic turmeric, 1/4 teaspoon black pepper, 2 tablespoons extra virgin olive oil, juice of 1 fresh lemon in 8 ounces warm filtered water. Take twice daily for 8 weeks. This combination enhances circulation and cardiovascular health through synergistic effects. The turmeric provides curcumin, which works with capsaicin to reduce inflammation and oxidative stress. The black pepper contains piperine, which increases capsaicin absorption by up to 2,000%. The olive oil ensures fat-soluble compound absorption while providing additional cardiovascular benefits. Pain relief formula. Combine ½ teaspoon cayenne, 1 teaspoon organic ginger powder, 1 tablespoon raw honey in 8 ounces warm water. Take 3 times daily as needed for active pain management. This protocol works for arthritis, neuropathy, migraines, and fibromyalgia through complementary mechanisms. The ginger amplifies anti-inflammatory effects while providing its own pain-relieving compounds called gingerols. The honey soothes the digestive tract and provides antimicrobial benefits. Weight Loss Accelerator. Mix ½ teaspoon cayenne, 1 tablespoon raw apple cider vinegar, 1 teaspoon Ceylon cinnamon in 8 ounces room temperature water. Take 15 to 30 minutes before meals 3 times daily. This metabolism booster enhances fat burning and appetite control through complementary mechanisms. The apple cider vinegar improves insulin sensitivity and reduces blood sugar spikes. The cinnamon regulates glucose metabolism and enhances the thermogenic effects of capsaicin. Immune Booster Protocol. Combine 1/4 teaspoon cayenne, 2 crushed organic garlic cloves, 1 tablespoon raw manuka honey, juice of 1 fresh lemon in 8 ounces warm water. Take twice daily during cold and flu season. This protocol provides comprehensive antimicrobial protection through multiple active compounds working synergistically. Quality and sourcing. Choosing high-quality cayenne determines your results. Organic certification is essential to avoid pesticides, heavy metals, and contaminants. Look for USDA Organic Seal. Standard cayenne contains 30,000 to 50,000 Scoville heat units. Verify SU rating on label for therapeutic potency. Color indicates freshness and potency. Bright red-orange signals active compounds. Dull brown means degraded capsaicin. Strong pungent aroma confirms quality. Store in cool, dark, dry place in airtight glass container. Refrigerate after opening to preserve potency. Common mistakes to avoid. These 7 mistakes destroy cayenne pepper benefits. Taking too much initially causes severe stomach distress. Start with 1/8 teaspoon, increasing gradually over 2 weeks. Using low-quality cayenne with insufficient capsaicin provides reduced benefits. Not combining with black pepper reduces absorption significantly. Always add 1/4 teaspoon. Taking on empty stomach causes gastric irritation in sensitive individuals. Expecting overnight results leads to abandonment. Most benefits require 2 to 4 weeks consistency. Not addressing root causes limits results. Combine with healthy lifestyle changes. Ignoring drug interactions causes complications. Always consult healthcare providers. We've covered all 15 science-backed cayenne pepper benefits comprehensively, from supporting cardiovascular health and managing blood pressure naturally to powerful arthritis pain relief and metabolism enhancement. The proper dosage ranges from quarter to half teaspoon daily using quality cayenne with 30,000 to 50,000 SHU. We've revealed combination protocols that multiply effectiveness, safety guidelines to prevent complications, and quality sourcing tips for maximum potency. Understanding these 15 benefits turns guessing into strategy. Dosage isn't just important, it's the difference between mediocre results and transformation. Here's the friendly reminder: quality and consistency matter immensely. Many cayenne products are low quality with insufficient capsaicin. The active compounds that deliver these benefits degrade rapidly with heat and light. Fresh, high-SHU cayenne in dark glass bottles is non-negotiable for real results. Watch next: the 10 biggest black seed oil benefits you've been missing for years, and how to use it right, where we reveal the immune-boosting powerhouse containing thymoquinone that works synergistically with cayenne pepper, including the one benefit pharmaceutical companies desperately don't want you to know about. Share this with someone over 45 struggling with heart health, chronic pain, or weight management. Comment Cayenne Power. If you'll start the Cardiovascular Cleanse protocol this week and track your blood pressure, pain levels, and energy, your transformation starts now.